Hi, Dr. Saxena here, and been talking about something on one particular doctor which I always got impressed, which was Dr. Tilden, and this was he was ahead of his time, and I can always tell you his ideas were far superior to modern drug remedies, and this particularly was a kind of this particular thing. He's in the most chronic diseases situations, especially one that has baffled all the medical geniuses. Tilda's approach should be tried first. If one has to have a hope at all of all complete and permanent recovery. Thomas Sydenham, this was another guy. He was a famous English physician in the 17th century, and he supported Tilden, and he told diseases are nothing else uh, than an attempt on the part of the body to rid itself of morbific matter. This is morbific means dead or rotting. So this with this background, I would like to talk about there are whatever Dr. Tilden has worked. This is if it normal the reason for main food to remain undigested is lack of enzymes, and we eat trashy food, and we can't digest it all, and it remains in our intestines in a rotting form for weeks sometimes, and eventually the productive intestinal lining in weakens, and this particular causes allows some rotting undigested food debris to enter into the bloodstream, which we call it as a leaky gut syndrome. And I never knew about this unless I worked in autism and understand what is this thing called leaky gut syndrome, and started. So what happens is here is once in the blood, this toxic debris can settle just about anywhere. As a foreign protein, the debris, what happens, the debris can irritate an inflammatory reaction to a particular location where it happens to end up. So the SNAP diagnosis is that we have a problem at the site of inflammation, but really, which is can be joints, can be muscles, can be liver, kidneys, or intestines, or stomach, or whatever. So this there are we are given drugs to cover up that symptoms. If we have inflammation in the joints, we believe we take the joint treatment, then we are fine. So see. Doctors pretend, I'm not trying to show this particular thing, but there is some kind of the we need to understand from your experience. See, they pretend that a single part is in isolation, is having a problem, rather than the rest of the body. That's why the things, whatever isolated drugs what we give for the joint and that stuff, it doesn't work. So this, according to Dr. Tilden, these types of chronic mysterious illness almost have something called toxemia as the root cause. So this particular thing, I have been talking about. I have been on record talking about what are the foods which we are not supposed to take, and I've been making a lot of videos about how this processed foods and all that. What are these artificial devitalized foods? They are coming to our diet, and how we can go ahead with that. So but just being a critic is not going to be enough of food alteration. I try to work out on something. Even if you are able, if you are consuming some things, you should always have some way to eliminate it properly, so that it doesn't rot there and cause much problems here. So I'm talking here about I can't prevent Coca-Cola company from sugar. I cannot prevent bleach floors. I cannot prevent refined sugars and sale of adulterated devitalized foods. These things are on the thing, and if someone tries to understand what is this integrative medicine, we try to work out on thing, and we start giving a kind of advice along with some kind of detoxification, trying to see that one organ doesn't suffer more, We try to see that the whole process of elimination, the whole body, there has to be some improvement in that particular stuff. Then there will be a good response with the whatever things what we are using, because these are the days of supermarket industry, and it is somewhere we are. When I call about this, I still have to depend on some of the supermarket foods, because I don't have any other place to take. Yes, we try to do our best to see that we don't get into that, but having taken that particular thing, we try to see that the how you can always, because I can always talk about how, even if you're taking all these things, the first most common organ which get overwhelmed with this constant deluge of toxic fast foods is the liver. Liver is the most important organ. It works overtime, and it works 24 by 7. It's overtime, and see, um, we uh, we need to see that what this liver is then supposed to choose can help that out. We need to optimize that liver. Liver has got two, three components. Unfortunately, whatever tests we do with liver function tests and all that are not enough to tell that you have some liver weakness and all that. So we depend on clinical things as such. Um, so what 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 happens? How things are going from? I just want to show you that this particular thing is liver is working overtime instead of see, lot of chemicals. It has to trade with lot of chemicals. Liver, there is a thing called phase one, phase two, and data things which happens in the liver, and human liver has evolved from 60 million years of animal liver evolution. For all but last 100 years of the man's 20,000 years, that is 2 lakh years, the human diet was simple before accepting this last century, 100 years, whatever things were there before, the human diet was presumably only fruits and vegetables with a little animal protein. The human diet was very simple. So when the liver allowed to develop normally uh, and concentrate on its main task, which did not involve toxic waste breakdown. So what happened with the modern processed foods is are a shock to evolution. See this. What happens is that to force the liver and kidneys to work harder by falsely whipping them into action by adrenal stimulating steroid and diuretic drugs, which are standard medical approach. This short-term solution will ultimately result in organ destruction. So I don't want to be very this one here, but I always tell you, your liver is working overtime, your kidneys are working overtime, and you give diuretic also. You try to work on some adrenal stimulating corticosteroids and all that. It is not going to help this problem at all. The liver and kidneys were never meant to work this hard, spending all the metabolic energy trying to deal with this processed foods from your Hollywood diet. So you are getting into slowly into some kind of problem, which is an unforeseen problem, and you need to see that how you get out of that particular problem. You need to work it out. Yes, I always am. I feel that there has to be some just this is not the problem, because when you get into some chronic problem, the problem is not just the diet. We normally think that okay, we correct the diet and everything will fine, because whatever diet we are getting is still having some lot of refined things and something which is very nasty. So you need to work out slightly more than that and trying to see that all your organs of elimination are properly working. So this is what we try to work from our level. It's an individualized program, not just one particular thing. We talk about how this we are not interested in these promotions and all that. we high protein diet, soya diet is such a fantastic, all kind of things. I am not interested in that. I believe that every person has to have a personalized diet based on his capacities. What is the kind of the liver is over, what is the kind of thing, or but this guy is sweating or not, what is the kind of he has get that kind of stools and all that. So all this thing we can make a process. We can always make him. Uh, I tell you very simply, we need to clean as we clean our skin with a good soap and good this one cleanser. You need internal organs also has to be clean, because we are day in and day out are having a lot of things which are floating around in our thing, and we have to work with all that. I can always tell you one of the commonest symptoms with all these problems, what people are having, is one thing called fatigue. Everyone is yeah, telling about that. Stuffy nose. You have got some people have sneezing. Some people have blocked sinus. Some people have got skin rashes. Somebody has got something like fatigue, fibromyalgia or chronic fatigue syndrome. So all these things are signs that yes, there is something toxemia which is happening, and you need some out of box solution. And we are here trying to work on this, and this is the way we this integrative medicine can help most of us. I try to practice that way. I try to. It's not. It's very difficult. I cannot say no to a pizza. I cannot say no to something. I tend to take that thing, but I always see that my organs of elimination are not overloaded, and I try to stay away with things which are nasty. But and see that once this organs of elimination is normal, then I can always. So that's the same protocol we try to devise for the patients and work out. Thank you.